Okay, thank you for joining us. So, for those of you that don't know, I am Jolene Short and I work for Homeward Bound Animal Behavior and Training. And we're here with the behavior topic today. And I'm super excited because I've got super awesome ladies with me here. So today joining me is Dr. Terri Argotsinger, who works at Homeward Bound. You work at Homeward Bound now, Terri. Who works who works at Ankeny Animal and Avian Clinic. And I've also got Cassie Cook here, who also works for Ankeny Animal and Avian Clinic. And they are going to be here talking to us today about fear-free medicine because it's near and dear to my heart. These ladies are near and dear to my heart. I worked at Ankeny Animal and Avian Clinic for 3 years. It was an amazing experience, and I have so much respect for what these guys do here. So fear-free is something that's extremely important to me as a behavior professional. And and we love working with vet clinics in conjunction with vet clinics and partnering to really team up and be team whoever the animal is. And so this just kind of is a lovely addition to all of that. So, okay. So I wanted to talk to you guys about it, but I don't know if either one of you wants to start, but I just would like to start with like a basic, what is fear-free? What does that mean? What does that mean for you guys? Like, what do you do?
Yeah, fear-free is based off of low stress handling principles. It is fear-free is it's technically a brand, but it is currently probably one of the most widespread certifications and educational platforms for veterinary professionals, groomers, dog trainers, and pet parents. And it really takes into account not only the pet's physical well-being, but the emotional and mental well-being as well. It lets us train to know our patients better and treat them better. And because there have been a lot of studies on how, stress from the veterinary clinics visits, even if it's just once a year, can have some lasting behavioral and physical ramifications. And so to mitigate those and try to prevent those, fear-free is a really great way to train veterinary professionals in particular on how to better treat our patients.
It's just one component. It's not like we just do one thing. It encompasses the the entire clinic. So everywhere from our receptionists to our technicians to the doctors to how we interact with the owners. It's a very all-encompassing process.
Well, and so it's kind of the way that I always felt about it is it's very much a culture there. Like it is a culture, is a way of existing. It's an entirely almost kind of different way of practicing medicine, right? Like
it's definitely a different and a newer, and I personally think better approach to medicine.
Yeah, awesome. So I'm gonna ask Terri, so have you always worked at a fear-free vet? You worked at a regular vet. And by the way, let me put the little asterisk here on our talk. This is not in any way, shaming or putting down vet clinics who do not practice fear-free. This is more just to give an idea of what the differences can be. And so, in either choosing a vet clinic or vet clinics who are considering potentially going this route, this is really good information to have. But let you answer that question.
So the clinic I was at prior to coming here about a little over 4 years ago was not fear-free. It was pretty much you got done however you could get it done. And sometimes, maybe that was not in the pet's best interest.
Sure.
This I have seen, we actually get, I feel, better results, not only in patient health, but patient mental health as well, by taking the slower fear-free approach. I'm going to get more done, even if it might take just a bit longer to get there, but the dog is going to be, or the cat is going to be so much happier in the long run.
Oh, absolutely. Absolutely. And that kind of like perfectly segues. And I want to ask you both because so Dr. Terri is obviously a veterinarian and Cassie is what's your title there? Tell me.
I'm a technician. I'm not.
Okay. I was like, I want to call you a technician. I'm sure that's right. But like, I always refer to myself as an exam room, whatever. I don't know.
Yeah.
Anyways, semantics. But anyways, I kind of want to get an idea from each of you of like what some of the stuff like that you do to make the experience fear-free for the pets in your particular position. So why don't we start with you, Cassie? Go ahead and tell us a little bit about what does that look like for you?
Yeah, well, we are very fortunate first of all, before I forget to say, I want to say that we have only been doing this fear-free program and low stress practices for 6 years.
Yeah.
So this happened.
So before you worked before it was fear-free also, right?
Yeah, yes, I've been here for almost 10 years. And so I have been there through the transition of traditional medicine through the fear-free learning program and process. So it really starts with the environment and making it a pet-friendly environment, taking into account not only how we're approaching the dog, how we're handling and restraining the dog, but I mean, the biggest thing is really treats. Having treats available, a very wide variety of treats, but also taking into account animals' other senses such as sight, sound, smell is a huge one. We do calming pheromones, and we don't use any super abrasive cleaners that are going to kind of burn their nostrils. So it's really thinking about what this experience looks like from the pet's perspective.
Yeah.
And that's just kind of all your setup. So once you have your setup, you get into the good stuff, which is we have modified our restraint techniques. You know, it used to be in there and going full restraint every patient, scruffing cats. That has really changed quite a bit. There are a lot of animals that I don't have to restrain because they're happy to be looked at, being distracted with treats. We have changed our blood draw techniques. So, I mean, heartworm tests when I started were every time, hold the dog in full restraint, cephalic blood draw, that's how you got your heartworm test. Now we take a look at a patient's history. We take emotional histories on every patient. We do a lot of saphenous blood draws because animals don't like us in their face. We did one this morning with a kind of a nervous husky who we just kind of had to play with what she was most comfortable with. So Dr. Terri held off a saphenous vein, which is the back leg, I guess I should say for other people, back leg on a husky. And she held it off for me and I drew the blood while the husky licked cheese off of a licky mat. So we had the owner have a hold of her collar just for, safety measures, but a lot of adapting to the patient's comfort level and taking notes and adjusting as we need to.
Yeah. I can't even I was like thinking about that. I'm like, I can't even, the number of times there were doctors or technicians like on their back, like on the floor, trying to draw blood from the dog. So we're not manipulating the dog in a way that makes them uncomfortable.
And it sounds like it's a lot more work, but honestly, it's less work because you're not putting your full body into it for every patient every day, every time. So it's a lot better on a lot of our staff physically and mentally and emotionally.
Yes.
So,
well, and also, of course, safety is always number one, but that kind of stuff, when we're not scaring the bejesus out of an animal, they're much less likely to bite us. So your bite rates go down dramatically when you use these kinds of techniques. So that's a big deal. And nobody wants to bring their animal in and have their animal bite someone at the vet clinic. So it's good for everybody.
It's tough on owners when not only tough on animals, it's tough on owners when the vet visit doesn't go. And even though we understand and are very passionate, there's still a level of embarrassment. I mean, even for our pets.
Yes, I know. Thinking about Traveler and just being like, yeah, for sure. Absolutely. No, that makes perfect sense. And what about you, Terri? What differences in how you go about your exams does this make for you?
I would say that kind of two approaches. One is how I actually do the exam. I'm not a set pattern every single time. I have to look at this first and then work my way down. I'm going to see what the animal likes. Like, for example, cats sometimes aren't a big fan of being messed around their head. So what I'll do is I'm going to start at the belly and feel kind of parts where they're not so worried, and then kind of work my way back to the tail. And maybe then I'll finish up with the head and look at the teeth last, because most cats, that's the part they hate the most. So
Yeah.
save that for the end of the exam.
Yeah.
We also do some, you know, that sun.
You're like, I was gonna say you're like bathing and you're like bathing
Yeah.
in like light.
Let's try to get out of there, but I don't know if we're going
A
to.
little bit better. The other thing I do a lot on exam is something called a touch gradient. So instead of just immediately shoving my hands on the pet right away, I'm going to start with just maybe some gentle petting in an area where they're not upset. And then I'm going to start working my way down to, if there's a sore leg, just slowly getting down there. Or a lot of times, like with a stethoscope, I'm going to offer them to kind of, do you want to smell it? Do you want to check it out first? So instead of me just slapping it right on there, most animals are a lot more comfortable if I'm taking a slower, gradual approach instead of just, let's get this done right away.
Right. Oh yeah. The gradient touch thing. Oh my gosh. I mean, that's huge, right? Because like, if we're constantly put our hands here, stop and do this, put our hands here, it's very jarring to their senses. And so when we're like putting our hand down and making a conscious effort to go, I want to get stuff done and I want to not take my hand off them because they know it's there, they're getting adjusted to it. Like, that's huge. Yeah.
Yeah,
for sure. And Cassie, you obviously mentioned the myriad of treats, right? So like, that's a big one. And it's the same thing with cats, right? Although cats, you know, with treats, there's a little less options, so to speak. But I think you guys had those like churros for a while or whatever. Maybe
So
have them.
Yep.
Churros are amazing.
They really are. That's probably still our first go-to, but there's canned chicken, we use cheese, we use
catnip.
Yeah, catnip, marshmallows, Cheerios. I said we've got, as I joke, bribery all over the place. We're like grandma's house. We've got all the good stuff. Anything we can try to do to motivate the pet to be more focused on that than they are on us.
Right, absolutely. And there's something that sort of course, the pandemic has dramatically changed it. That was a pretty big part of you guys' fear-free practices, right? Was happy visits.
Yeah.
So happy visits meaning, hey, bring your pet by and let them come in and let us just give them treats or pets or attention or whatever they want. Right. And then they go away and
nothing bad happens. No pokes, no nothing. Yeah, that's huge. I mean, it's basically a watered down version of an actual intense counter conditioning things that you would do. I mean, the best way that I can think of it is your dog likes to go to the bank because when he's in the car and he sees the bank, he knows he gets treats. So McDonald's, he gets a fry. And that is kind of the mindset that we're wanting to get some animals in when they see the vet clinic.
There's some, as soon as they come in the door, they will walk over and walk right to the technician, sit down and stare at them like, okay, where's my peanut butter? I know you're going to give it to me. So it's amazing how much they'll pick up positive things like that too.
Yeah,
absolutely.
Unfortunately, it's not something we've been able to do. Because of the pandemic. We're also in the midst of a huge expansion. So we've got a lot of construction going on, and we're kind of afraid that it would do more harm than good for some kids. So it's definitely something we're going to be revisiting. But once the construction's done, which who knows when that will be.
Yeah, no, that's fair. Yeah, it is like it's sort of funny because everything that happens, and we don't have a customer service rep here. Becca didn't want to camera shy, but we didn't have somebody to come in and talk about that. But like everything from the moment they walk in the door until the moment they walk out the door, everything is designed to try to do the least amount of harm, lower the stress levels, all of that stuff. And all of that is important. But when you have a dog who's really, really quite afraid and has, either an intense learned history with vet clinics or it's just not used to or knowing what to expect, those happy visits are the difference between distract, and a dog that actually enjoys being here, right? Like, so I know of course, people just don't think about it very often, right? I go to the vet once a year, typically, like we just go in, we get it done, we get it over with. And they don't think about that, but it can make such a huge difference. And I'll never forget several clients who had been really dedicated to the Happy Visit program and were like, oh my God,
Yeah.
this is crazy. Like it's made such a huge difference. So the other thing that I want to talk about is we wanted to talk about like what difference does it make for the animals, and we're going to dive a little bit more into that here towards the end, but I want to talk about what's the difference. How would you describe the difference between you doing your job pre-fear free versus you doing your job after fear free? What difference is it making for your job, for your patients, all of that kind of stuff?
Less bruising. I would come home covered in scratches, bites, bruises. I would be black and blue up and down my legs from literally trying to hold dogs down or hold cats to try to get blood. And that, I'm not going to say it never happens anymore, but it definitely less.
Yeah.
I think there is more of a partnership between, there's a bigger feeling of partnership and empathy for our patients between, I mean, I can speak for myself, between me and the patients, is because, okay, we're going to get through this together by doing this, this, and this. And there is a mutual give and take there. I feel like I know my patients better, and I can give them the kind of care that I think that they deserve. And so there's a better understanding of your patient. I can, and like she said, the bites and the scratches and the bruises, I'll go down. There's a better, when your patients don't stress you out, that's energy that you can give and appropriately kind of deal with your coworkers, because veterinary medicine is incredibly difficult. I think anybody that's been in there can tell you, any kind of dog, pet related, it's emotionally and physically and mentally challenging on a consistent basis. And anything that we can do to mitigate that and support our staff and our coworkers is worth going for. And coming out of every appointment exhausted and frustrated because of how things went, just kind of feeds into a negative energy around the clinic, and not having to deal with that, or being able to focus on victories, like we got the blood draw this time, like, yes, this is what we need to do next time. Those focusing on positives can make a huge difference, I think, in the clinic, and I can tell you in this clinic has.
Coming out of an appointment where the first time you saw that dog, maybe a couple weeks ago, you couldn't get near it. It was sitting on the other side of the room growling at you. Maybe it's a second appointment, maybe it's a few more down the road, but the dogs that then suddenly, not only can I touch them, I can pet them, I can do their vaccines, just that turnaround to see a dog that was terrified from being here to, okay, maybe they still don't really like it, but they're like, oh, okay, we'll just get this done. And then, the good stuff happens. So just seeing that, you just feel so good that you're doing something right. And that dog isn't terrified because of what we did.
Yeah, absolutely. Oh, that description is so great, because you're right. We, of course, as a behavior professional, when I think about fear-free, I'm so focused on the animal aspect, which is of course what it's about, right? Like that the most animals that go into a vet clinic are not like jazzed to be there. They're like, okay, they do really weird stuff here and it's scary and I have no control over what happens to me. And so it's great for that, but also that makes perfect sense that when your experiences with the animals and the outcomes with the animals are so much better, that allows you more elasticity in what you're dealing with mentally throughout your day, because it is an exhausting job. Like it just is. So yeah, I think that's great. I kind of one of the last things that I really wanted to talk about was, and I can talk about this because I know this from experience from working at the clinic, is that of course I want to kind of address like people who would come in and, want to get all this stuff done for their animal. And we go, gee, it's not going to happen today. Because we're not going to push, the animal is too stressed, right? There's a threshold point, right? And if the animal is too stressed, then we want to back off and we want to go, okay, what can we do for this dog? Because if you guys hold the dog down, if you force it, if you put that animal through that level of stress, all that means is it just escalates the next time they come in, until they have an animal that has to be sedated for every single thing that has to happen to them, right? And as someone who has an animal like that, I can understand that that's not anywhere anybody wants to be with their animal. But sometimes I know it's frustrating for people, they go, gosh, just get it done and over with. Like, I just want to get it done. What's all this fuss about, right? And what they don't realize is that not only are we trying to prevent them from having to expend the finances and the stress of having to sedate their animal every time they come in for something in the future, but also that like, and we're going to have a conversation about this one day, hopefully in the near future, but behavioral health and physical health can have a lot of implications on each other, a lot. And so in order to care the most about, or care about that physical health being as optimal as possible, we have to care about their behavioral health and their emotional health. And so what you guys do is, hey, we've learned we don't have to do things this way. Are there animals that are still going to need sedated? Yeah. And those are the animals that were like, happy visits, right? Like, so, when I was there, it was like, oh yeah, these are the animals that like really, really need that. We would love that for preventative measures for everybody. But like, if your dog has to be sedated, that's where we have to start. We have to start changing the emotional response of the animal before the treats and all the other stuff will be effective.
Before they're even interested.
Yeah, exactly. But I know that there are people out there that can get frustrated with it and go, gosh, like, I think most people, I think you would agree, most people actually really love this. They're really impressed by it. It never maybe occurred to them sometimes, but they're like, wow, like, this is it makes such huge impact. But every once in a while you get someone who's frustrated because they just want to get their stuff done. And so I kind of wanted to bring that up because I'm like, I can empathize with that feeling, but also I want those people out there that would think that to understand, like, there are so many benefits and reasons to why it's not about making your life more miserable for having to come in more, right? So what do you guys have to say about that?
So I think 95 to 99% of the time, the remedy to their kind of that pushback that you feel is explaining what you're seeing. Be like, this is how I know we've gone too far. Talking about the body language, talking about they're not taking treats anymore, talking about if I do this, I'm afraid this happens. So just being super open and honest, and being secure. We're really lucky because we have owners where we have the confidence to be able to say no and know that we're not going to get in trouble for it. Because this is the kind of medicine that we want to practice, and we stand behind it because we believe in it and we believe it's the best for our patients. There have been clients that are not happy and they choose to go elsewhere. It's not a lot. And that is a difference that we can't reconcile because there are differences in values of what they want for their pet versus what we want to provide for their pet. And that's fine. It's their animal and it's their decision. But we very rarely will cave to an owner, very rarely, if ever, cave to an owner's pressure of, I just want you to get it done. There have been a couple of owners saying that I have to say, I'm sorry, I can't do that. It's not in the best interest of your animal. Here's what else I can do. We have several different plans that we can talk about. We can answer their questions about any of those plans. Just So explaining to them what's happening, why it's not going to happen the way they want to, and how we can get it to happen in a better way for everybody,
Right.
are kind of the main important things that we kind of deal with.
Yeah.
Owners.
It's educating, right? Like it's just educating. It's a total, so many people that are not familiar with it, that it's so strange. And you know what I mean? They're just used to, this is the way things have always been. But, you know, I do think that, it is really interesting, because I think a lot of people are like always like, oh, like you're afraid to get bit. And it's like, well, no, these people have been literally trained on how to avoid getting bit and getting the job done the old school way, right? Like it's not about like, oh, I'm afraid your animal's going to bite me, or, you know, this kind of stuff. It's not about that. It's about the emotional well-being of the animal, right?
Yeah.
Right. Yeah.
And if people, I know that people think that I'm the owner of a pit bull, so I'm very aware of stereotypes and how other people may view my dog. So I 100% where they get from, where they're coming from with that.
Right.
Which is why the education and the conversation part of it is so much more important.
Yeah. Yeah, absolutely. And by the way, and especially now with you guys' like renovations, but you guys have like the coolest setup at your clinic. So you've got rooms that are specific to cats and like pocket pets, right? Like small animals. And then you've got dog rooms and stuff like that. And then I don't remember, I know when I was there anyways, in the cat rooms, you had like a cat tree and stuff for them to, you know, stuff for them to feel homey about, like hiding places and stuff like that. I mean, I don't know about out there, but I feel like everybody's seen the like the pictures, right? Like the run of pictures of cats like finding really bizarre places to hide in exam rooms when they go to the vet, right? But so you guys kind of provide like comforting things for them. And you know, same with your dogs, like you've got rugs in the room so that the floor is not super slick and, you know, hard and uncomfortable and that kind of stuff. So there's so much more to it than just giving a dog treats or giving a cat treats. There's so much more, right?
I've done exams where the cat's on the cat tree. I've done exams where the cat is hiding behind the computer. I sit on the floor for most of my appointments, and the whole, there is no one way to do things. It's, you take every pet and you do what's going to work best in that situation.
Right. Absolutely. Yes. I absolutely adore this. And this is, again, I want to bring this about. I'm all about people learning about this because, oh my God, the number of animals that I'm working with, that like, they're like, I'm like, go to your vet and get a medical check, right? Because I need to make sure that there are no physical problems that are contributing to your pet's behavior problem. And the number of people that go, they can't do anything with them, right? Like, and I'm like, okay, well, this is a problem because we need to be able to. So I look for where's a fear-free vet in your area. If you've got an animal like that, then that's the type of place you need to go, because they're going to take the extra time to make sure that we're sending this animal on the right path and getting those medical things done that need to be done, while also keeping everybody safe and keeping the pet healthy in that moment. So
I mean, you'd be surprised. We kind of tend to get sent the more fearful and stressed out patients because of the way that we practice. And there have been several patients that I can think of that they're like, they had to sedate my cat to look at her or give vaccines. And we didn't. And that's not because we're magical. It's because we have a good setup. We do what we can to make a good setup for them. And we work within the animal's realm of comfort as much as we can, so that we don't push them to that point where they're lunging out at us or trying to bite us or anything like that. So we're not magic. We're just, we move and we think different.
It's a different approach.
And I think, I mean, I really think that it's kind of the future of veterinary medicine. Behavior, I think, has always been a under-recognized part of veterinary medicine, not the actual study of behavioral medicine, but, you know, how do you know that your dog has an ear infection? It's scratching at its ear, it's shaking its head. How do you know your dog has a urinary tract infection? she's peeing a whole lot more. Those are behavioral changes that we use to diagnose a problem, or that owners use to say something's not right. So fear-free and low-stress medicine is just taking that a step further and kind of pushing it towards the veterinary professional in particular.
Right.
Which is amazing.
Yeah, absolutely. Oh my gosh. The number of cases I have had where someone just casually mentioned something that it didn't cross their mind to think anything of. And I'm like, go to your vet and tell them that. And then they go and there's this issue, right? Like, so yeah, it's huge. And again, I want to do another chat on behavior and physical health and how they coexist together and affect each other at some point. But I cannot tell you how much I appreciate you taking the time to talk to me today. Do you guys have any final thoughts or additions that you wanted to add?
I guess one thing I just want to mention, since we touched on sedation just a little bit and kind of saying, well, this is kind of a, that's kind of that last resort thing. Yes. It isn't a lot of times, but it isn't always the worst thing we can do either. There are some dogs that actually sedation or anxiety medication or something is actually going to be the less stressful route. So we always still take that into consideration because sometimes that is the best option. So I don't want to make it seem like we never do that or anything, but it's always just a consideration.
There's sort of like an kind of a general ladder of escalation of things you try, right? And for some animals, you don't necessarily have to go through all of the rungs to know what's the better option. And it also depends on what's going on. If you've got a dog that's got, is in emergent medical distress, that's different, right? Like you can't, okay, let's see if we can feed treats while we get a look at this broken leg or this, that kind of stuff. That's totally different. But for your wellness exams, for the things that aren't emergent, that don't need done right now, there's a whole slew of options that you pick and customize that plan to the individual pet and their needs.
Definitely.
My dog, I choose to sedate him, and that is the less stressful thing for him.
Right. Yep.
Yeah. It's like going to the dentist. If you have a panic attack every time you go to the dentist, you probably want a little bit of gas.
Yes.
Which is totally valid.
Yes. These aren't bad pets. They're not mean pets. Most of them are just scared. Yeah. And it's all just trying to do anything we can to reduce that fear.
Yeah.
Yes, absolutely. Absolutely. Yeah. There's so many different on the spectrum. There's so many different things that you could see with that too, right? Because like a dog, we all know, the dog that's hiding under the chair with its tail tucked and its head down and pushed away is scared. But a lot of people don't realize like that your pet is scared when it's standing on the table and look how good it's being. It's just standing there while it's frozen, right? Like it's choosing to freeze through the situation. And what happens when you put that dog down on the floor again? I used to joke because every time I would put a dog on the floor after an exam, before their feet would hit the floor, I'd say, shake it off, and they'd get down and they'd shake off. And then the owners would kind of look at me and I'd be like, yeah, I knew that was coming because I knew your dog was tense. And as soon as it got into a more like a less stressful position, it was going to shake all that excess stress and that energy off. And so there's a whole window of what stress looks like in dogs. In fact, one of the least recognized, and this isn't just across vet clinics, because we do workshops for vet clinics and daycares and all these different things, is one of the things that people rarely recognize as stress is like hyperactivity, right? Like, so a dog jumping incessantly at you, like, and they're like, oh, they're just so excited. And I'm like, are they though? Like, and sometimes they are. Yeah. But not always. There's other things with it. So there are so many ways that can manifest, and it's so good. Like, it's amazing that you guys do what you do and that you educate the owners on what they're seeing, because not every owner is going to know that their dog is as stressed as they are, or their cat. Although I think most people kind of expect cats to just be displeased being in the vet clinic.
Generally annoyed.
Yes, exactly.
Something that kind of goes along with that I like to let people know anytime that I can, because it was kind of a mind explosion for me, is that a wagging tail is not always good.
Yeah.
A wagging tail, I went to a behavior symposium probably a few years ago, and the veterinary behaviorist that was giving the talk said a wagging tail is nothing but an exclamation on whatever the dog is feeling. So that means you need to pay attention to how are your dog's ears? Is he panting? Is he licking? Is he, other behavioral indicators of whatever stress or excitement. And then that tail just kind of amplifies that and puts a period on that.
Yes.
So even just for owners and for veterinary professionals, people, something that we do hear a lot is, oh, well, your tail's wagging, you're fine. And that's not necessarily the case.
Yeah.
Absolutely. Yeah. The tail wag is honestly, as a behavior professional, it's probably one of the most misinterpreted pieces of body language with owners. And so that's very much exactly how I describe it. It's like, I'm more looking at where's your dog's weight shifted on their legs, and are their pupils dilated? Are they stiff or still? Are they trembling? Are they, there's so many other pieces of the puzzle that are much more telling. And then the tail is sort of, okay, we've determined this is how the dog's feeling, and the tail and its level of activity is going to be
extension of that feeling.
Yeah. Yes, exactly.
On the cat side of things, same thing goes to purring. Purring doesn't always mean a happy cat.
That's true.
Purring can be a sign of stress and things like that as well. So the things people take as, oh, this is a good sign, we always take in light of the rest of the pet.
Yes. Well, that's why we always talk about, we look at the whole picture, right? We look at the whole animal and decide what. God, Terri, I was just thinking about this the other day. I was in a room with you back in the day, and I remember this cat like walking around and like was super friendly and was rubbing on us and rolling around, and we were like rubbing his belly, and he was great. And you were doing your exam where it's like, if you walk over to me, I'll start looking, and if you walk away, I'm going to let you walk away. And you tried to look at his mouth or something, and he walked away, and we went, okay, no big deal. He's going to cool off. And then he came back over and started like rolling around and rubbing again. And I went to pet him, and he just nailed me. And I was too busy going, oh, well, this is what he was doing before, so I'm sure he's fine with it now, but he just experienced a stress event. And so all of that rolling around and purring very well could have been self-soothing. I'm trying to calm myself down. And I took that as an open invitation to pet him again, and he was not okay with it. So
consent is wrong.
Yes, exactly. Exactly. So, it's very interesting, but you guys reading body language is a determination of, what you should be doing. Is obviously, it makes such a huge difference for the pets, rather than just, we're gonna, hold you in a like heavy restraint, which of course freaks them out even more, right? Like, I 100% guarantee if someone like walked me into a room that I didn't know and tried to hold me down, I would not be handling that well.
Yes.
So my child self would tell you that as well. I had to be held down for shots. So like, it's it's not a good thing if we can avoid it. And so I like I said, I appreciate you guys taking the time to talk to me about this. This is so important. I want all of the vet clinics to be fear-free one day. That would be awesome. So if you are a vet clinic or work for a vet clinic and you're watching and you're interested in more information, please feel free to Google fear-free. You can reach out to me. I'm happy to answer questions, but it is really a game changer for not only the animals in your care, but also your own mental well-being at your job.
Definitely.
And then a couple other things on that. If you're a fear-free, or if you're a veterinary professional and you're like, this is something I really, really want to do, but there's no way that my clinic is gonna, deal with that. I would like to encourage you and empower you, because you practice medicine the way that you should practice medicine the way that you want to practice medicine. There is individual certification, there is practice certification. And then also, if you're a dog owner, they have a website with a bunch of amazing information to let you know how your dog is doing, like to read your dog better and to just get to know them better and to be an advocate for them, because you are, as a pet owner, you're their biggest advocate. No matter how many times we see them here, you know them better than we do. And if that's something that you're interested in, it's something like fearfreehappyhomes.com or something like that.
Yeah.
Has a bunch of free information and videos.
Yes.
That's fantastic. So
Yes, absolutely. Absolutely. Yes, and I will tell everybody, feel free to go check out Ankeny Animal and Avian Clinic's YouTube page. It's got some super awesome videos on it. I really love you guys' videos. They do a great job to explain kind of what you're all about and more about Fear Free, right? And that kind of stuff. So yeah, like I said, if anybody has any questions, you can feel free to comment below. You can reach out to myself or Emily. You can check out their YouTube page, but hopefully I will have these ladies back on sometime soon to have more awesome discussions.
for sure, absolutely.
Thank you so much for your time. And I'm
Happy
gonna
to.
let you guys get back to work and have a good rest of your day.
Excellent. This was wonderful chatting.
Yeah. Bye, everybody.
Bye.
Bye.